And you probably all just received a notice that there's a recording. I'm going to go ahead and get us started. So welcome everyone to our, oh, that says February, my bad. Welcome everyone to our March Northeast session for our collaborative planning and implementation group within the Northeast. Next slide, please. As you heard, we are recording this session. And we would just like to let everyone know that this session is going to be recorded and shared once the session concludes. Next slide. Again, welcome to those of you who are just joining us. If you can place yourselves on mute, and then just to go over a few housekeeping items before we get started. Today we'll focus on a few items, but before we get into those, I'd like to invite you all to update your Zoom name to include your name, preferred pronouns, and the name of your organization so that we can get to know one another and determine who's here. And then while you are updating that, if you can please, in the chat, let us know how your organization is currently engaging in CalAIM. This will give us an opportunity, as well as others in the room, to identify how you are all working on implementing CalAIM and to identify where we, as well as others, can seek peer-to-peer support. And then third, which is the most important, we want to strongly encourage you all to engage. This space has been designed specifically for you so that we can work together to make CalAIM a success. So in addition to posing questions towards the facilitators, please peer network, engage one another, and uplift your experiences and needs. Next slide, please. Before we get into the bulk of today's agenda, what we wanted to do was just do a quick round of introductions. As you all know, my name is Melissa Meza. I am a senior program manager with Health Begins, and we have our wonderful facilitators here from Everyday Impact Consulting. I'm going to go ahead and get started with Vince and Maiku to go ahead and introduce themselves. I do see a few new people here, so we want to make sure that you are aware of who your facilitators are. And then once Vince and Maiku close out with their introductions, we'll go ahead and call on 3 new participants to give a brief introduction. We'll ask you to share your name and organization, and then, voice over how your organization is currently engaging in CalAIM. So I'll first hand it off to Vince, who I see on my camera right now.
Thank you, Melissa, and hello, everyone. It's nice to be in this space. This is my 3rd time to interact with this group as facilitator. I'm Vince Salas. Pronouns are he, him. I work for Everyday Impact Consulting, and this project is really important for me because my mom is also a medical member. So the goals that we want to accomplish for Medi-Cal and consequently through this project are personally very important for me. Thank you for being here.
Thank you so much, Vince. And then Maiku.
Hi, good afternoon, everyone. My name is Maiku Tao. I use she, her pronouns, also with the Everyday Impact Consulting team and your co-facilitator in this space today. Also want to voice over, the importance of this work for me. I actually grew up on Medi-Cal benefits. And so, it's a full circle getting to do this work and ensuring that folks have the same access that I had growing up. And so really excited to get into today's conversations.
Thank you so much, Maiku. And I'm going to quickly look at our participant list and see if I can spot any new participants. I'm going to go with Toby Crum. If you can share your name, organization, as well as how you guys are currently engaging in CalAIM.
Hi. Can you hear me?
Yes, we can hear you.
Okay, my name is Toby Crum. I'm from Visions of the Cross. We have ECM and community supports. We also have inpatient women and men's residential treatment, outpatient treatment, and intensive outpatient treatment, and sober living for men and women also.
Thank you so much, Toby. And then let's see, Jorge Medina.
Yes, can you hear me?
Yeah, we can hear you.
Oh, good. Hi, everybody. Good afternoon. My name is Jorge Medina. I'm here representing Serene Health, We currently do behavioral health, ECM services, and in my specific line is community support services. I'm the director of the community supports program for Serene Healthcare. It's a pleasure to be here. It's my first time on.
Thank you, Jorge, for joining us, and welcome. We hope to see you in the next upcoming sessions as well. Let's see. Emily Mers, and I apologize if you have already joined. I don't think you have.
Can you guys hear me okay?
Yes, we can.
Okay, sorry, I'm on a drive right now, but this is my first session with you guys. My name is Emily Mers. I'm from Orca Behavioral Health, and we applied for a grant late last year, and so we are hoping to participate in ECM and CalAIMs whenever we are able to get up and running. So right now I'm just learning about the environment and the landscape of Medi-Cal and the changes coming to it. So thank you guys.
Wonderful. Thank you so much, Emily, Jorge, and Toby. It sounds like a lot of you are in the early phases of CalAIM implementation or slowly integrating these services into your organizational practices. Next slide, please. So for those of you who did not get an opportunity to introduce yourselves, if you want to please utilize the chat and also drop in how your organization is engaging in CalAIM. I think that'll help support others in identifying peers that they can network with throughout today's session. But before I continue, what we wanted to share was our objectives for the day. And so with that being said, we have 3 objectives for today's session. By the end of today's session, participants will engage in action planning by 1, refining the project charter and aim statements intended to guide and inform the work of the Northeast Collaborative and finalize if there is an agreement amongst us. The second is to inform the measures that we'll use to track our collective progress and success towards those aims. And then finally, we're aiming to ensure that you're understanding your next action items and implementing our collaborative work plan over the next year. Next slide, please. In order to accomplish this, we've broken today's agenda down into 4 parts. A copy of today's deck is being provided in the chat, and you can click on any component of the agenda to access any specific information that you're looking to gain. But before we begin, to kick off this session, we are going to start with the welcome. As you know, we've already gone through our housekeeping introductions. We're now covering our session objectives and the agenda. The next piece of this is going over a few highlights, mainly covering our session takeaways and lessons learned. Part 3 is the bulk of today's time and where we'll spend most of our efforts throughout today's agenda. So that includes a group activity where we'll go over our aim statement and project charters. We'll also post a few session polls. We will have some breakout sessions and then an opportunity to reflect on those breakout sessions. Before we close today's session, we will share what comes next, as well as some immediate resources, and give a special thanks to our facilitators. And then now I'm going to hand it over to our colleagues at EIC. Vince, if you want to take it away from here.
Sure. Thank you, Melissa, for the segue there. So for those of you who are attending the meeting for the first time, and this will look familiar for some of you already who have attended the last 2 meetings, I just wanted to recap for you what we have discussed in previous meetings of this collaborative, and we're focusing on the Northeast, right? Specifically, 5 counties that include Lassen, Modoc, Siskiyou, Shasta, and Trinity. So these are the highlights of previous conversations. Number 1, we have discussed the goals and the background of the collaborative planning and implementation initiative. Number 2, we have started to draft the initial makings of an aim statement and project charter, and we will continue to share that with you this afternoon. Number 3, we shared our norms and agreements. And number 4, we are, as we continue with this process, cultivating a space that is meant for peer-to-peer dialogue, discussion, and learning and sharing of best practices across the Northeast counties who are engaging for this particular project. Next slide. So what have we learned so far from you? I just wanted to share that from our last conversation in February, we also have been meeting one-on-one with some individuals who've been part of previous conversations. And those individuals have also said, why don't you meet with so-and-so? So in between February and today's meeting, we have met with 4 to 5 individuals outside of this group, and for those who were recommended to us to meet with. And from those conversations, these are some of the things that we've learned from you. We have identified 4 barriers or challenges that have specific bullet points under each of them. So let me start off with capacity building and workforce. We have identified a priority to fill workforce development gaps among providers. We've also identified to develop spaces and opportunities for peer-to-peer support and learning across rural counties and communities. And lastly, we identified a need to expand ECM and community support service delivery. The next barrier that we've identified through your input is improved care coordination. So first bullet there is that we have developed this goal to develop cohesive coordination among MCP, these are managed care providers, ECM, and CS, Northeast partners and providers. The next bullet is CDPH and DHCS, improve partnerships and coordination with all system and key players, including managed care plan, which is in this region is the partnership health plan, ECM and CS providers, intermediaries, data information hubs, and TA providers. The next barrier that we have learned from you is around data sharing and workflows and systems. So among these priorities include improving upon current data sharing processes that will help streamline and train providers on how to best utilize these systems and processes based on their capacity and available funding to do so. Another goal is to determine feasible metrics for quality and performance and bridge the money gap to the HIE, or Health Information Exchange. And lastly, to identify technology solutions to help us in the data sharing and workflows and systems. And lastly, the fourth area that we have identified along with you around barriers is focus on sustainability and infrastructure. The first priority here is to identify the need for sustainability of the ECM and CS programs beyond the 5 years from the state. Right? And we're talking about the Department of Healthcare Services here. And secondly, to establish and monitor long-term results in partnerships among providers and managed care plans. So that's what we've learned from you so far. And now I'm gonna turn it over to my colleague, Mike Koo.
Thank you, Vince. Thank you for setting us up and just really sharing what we've learned since we started this, these monthly sessions at the start of January and earlier this year. So now we're going to get into part 3 of today, which is really around the action planning and the bulk of our conversations with you all. So if we could go to the next slide, I just want to show folks the progression of where we're going here, to help develop these project documents to support the overall Northeast Collaborative. And, for additional context, these collaboratives are also taking place statewide. And so, as Vince mentioned, we're focused on the 5 county areas that make up the Northeast Collaborative. And so, in previous sessions, we've already discussed the AIM statement, the project charter. And so today we're really going to be focused on finalizing and developing the AIM statement and project charter, as well as moving on to the driver diagrams and measurement strategy conversations for today. So So just wanted to show folks the progression of where we're going here. And if we can move to the next slide as well. So in the next 20 minutes or so, we're going to spend time taking a look at refining our AIM statements. So what you see on the slide right now are 2 AIM statements based on what we had heard in the previous conversations. Our hope is that we'll move forward with these 2 AIM statements for the Northeast Collaborative instead of just having one overall statement and encompassing statement, given the unique needs and varying levels of contracting and engagement with CalAIM implementation thus far. So as a reminder, an AIM statement, again, is a clear statement to forecast where a project or group is headed. This statement will keep us grounded in the activities that support the overall improvement in those areas that Vince had just outlined earlier. And so we'll go ahead and dive deeper into each of these statements. And then at the end, we'll launch some polls just to gauge from everyone how these statements are landing in terms of your experience as our ECM and CS supports. And so if we could,
Michael,
go ahead.
Alexis here. I just wanted to dive in just for one quick second. Thank you so much, Vince and Maiku, for setting us up for this conversation to refine our AIM statements. Hey everyone, my name is Alexis Taylor. I'm one of the senior program managers here at Health Begins. And because I see that we have a number of new participants today, I just wanted to add just a little bit more color to what Vince and Maiku just outlined for us. Because I know that we had a number of questions that were coming up during the first and second session, which leads me to think that there might be some of those same questions that, might still linger for those participants that are with us today before we go into refining those AIM statements. So I am going to drop a quick link in the chat for everyone, and it's just going to be a very high-level explainer of exactly what CPI is. We've heard feedback that there have been so many CalAIM initiatives, different programs, different collaboratives that are running. And so just a very brief explainer to help set you up for where we are today. And so at a very high level, we have 3 objectives that we're trying to establish with everyone today. The first is like your presence, us being here, convening this collaborative that is consistent of you as CalAIM stakeholders. Number 2, you've uplifted challenges with regards to either contracting or implementing CalAIM, and DHCS and PCG want to lend voice to those challenges. And what better way than hearing from you yourselves to let us know what those issues are, so that way we can do what we what's identified as the third priorities to resolve those issues, to work towards developing those resolution strategies. And so I know that Vince just covered a number of issues that had been presented over the last 2 sessions, from one-on-one conversations, from emails, feedback from the managed care plans, so on and so forth. And so because there were so many challenges that were being uplifted during the last session, participants, expressed it feeling overwhelming. And so we received that feedback. We heard that feedback. We partnered, with multiple stakeholders to refine these AIM statements. And so the goal with going over these AIM statements is to really question yourselves and say, hey, does this AIM, this goal that we have to accomplish by the end of our time together, meet the challenges that my organization is facing? And if not, how could we refine it to meet the need that your organization is facing? And so that's the goal of this conversation of refining these AIM statements, is just making sure that by the end of this time together as this collaborative, which is set to conclude in December of 2023, is this realistic for us to accomplish together? And so I just wanted to provide a little bit more color for those participants that are just now joining us, because I know we've had some really great conversations to date, and that there may have just been some information gaps, for you. And so this is really your space, a space for you to uplift what you've been experiencing. And we've prioritized authenticity in this space. So please don't hesitate to let us know, the challenges that you're facing, and how we can better tweak and refine these goals to meet the needs of your unique organization. And that was more so for the organizations that have not joined us today, because there's been a lot that has been discussed, just to make sure you feel up to speed and caught up. And sorry, Michael, I just wanted to give a little bit more color for those new faces that we have, or those new names, and feel more than free to join us on camera if you have space and capacity to do that.
Yep. Thank you, Alexis, and no apologies needed at all. This is really a space meant for us to, again, be thought partners together in getting to those solutions. And so appreciate you sharing that additional context and just the conversations that have taken place, Alexis. And so why don't we move to the next slide and dig into AIM statement number 1. And so what you're seeing here is, of course, the AIM statement that our teams had developed based off conversations. But on the right hand side of the slide, you'll see all of the bullets that and issue areas that Vince just went through earlier. And what you see in the pink and the light pink highlighted portions are what we pulled in order to develop this AIM statement number 1. So I'll go ahead and read it. AIM statement number 1. By December 31st, 2023, the Northeast Collaborative will increase the number of contracted ECM and community supports providers by 25% that adopt cross-cutting and equitable regional best practices to improve care coordination, referrals, workforce development, and data sharing workflows and systems. And so as you read through statement number 1, I want to just go back to, again, the previous conversations that we had, which are highlighted in the pink. That's really where we pulled in the information and synthesized it to develop this AIM statement. And some of the questions as you're taking a look at this, is this 25% an appropriate percentage to be considering? And is this also aligned with what you have shared in previous sessions or what we've learned from folks and partners in the last 2 sessions that we held? And so wanted to just pose some of those questions for consideration, but if we can go to the next slide, we'll go through AIM statement number 2. Okay. And so for AIM statement number 2, again, you'll see on the right-hand side that, that we have highlighted exactly where we've pulled the information and synthesized it to develop this AIM statement. So AIM statement number 2 reads, to build the capacity of Northeast stakeholders in the early phases of CalAIM implementation by December 31st, 2023, the collaborative will increase the number of eligible uncontracted ECM and CS providers that have secured CalAIM contracts by 25% and support at least 50% of remaining eligible uncontracted providers to move to the negotiations stage in the contracting process. And so for more context, the contracting stages that we are referring to is whether partners or providers are at the CalAIM Curious stage, certification, gap filling, negotiations, or already contracted as a provider. And so again, as you read through the statement, here are some other questions to consider. Are these the appropriate target measures for this AIM, and does this align with what you need, as well as is this the correct stage in the contracting process for you? So just some additional questions and considerations, but I'll go ahead. Mm-hmm.
Yeah, I was just going to see if we could jump back to AIM statement number 1 and give the group an opportunity to reflect on some of the questions that you asked, and of course, encouraging everyone to please unmute and let us know what your initial reactions are.
Great. Yeah, let's go back to AIM statement number 1.
Hey everyone, Alexis again. As everyone is reflecting on AIM statement number 1, I would love to see, is there anyone that's present right now? Melissa, I think you would be, and Mike, who you would be so much more familiar with the names of the participants that joined sessions 1 and 2, that were a part of those conversations, those AIM statement breakdowns and the problem identification conversation, to just uplift and reflect how this lands with you. And so just taking a very quick recap of AIM statement number 1, this would be for those contracted providers and entities that coordinate or collaborate with contracted providers. And this is really working towards the issues that were uplifted previously. I know one of the main goals that the participants had were to adopt and apply best practices to improve care coordination, referrals, and workforce development. And so just thinking about the issues and challenges that your organizations might be facing, does this sound like this is what you need to accomplish or achieve by the end of this time together, by the end of this year? And if not, we would love to hear why, and for those that have just joined us for the first time today, are any of those areas listed within that first AIM statement reflective of challenges you're experiencing? Or is there something new that you would like to uplift just to pose to the group to consider for revision for that AIM statement? And like we said, this is definitely your space. So feel more than free to just unmute or use the chat and just dive right in, because we definitely want to reflect upon what your needs are.
Yeah, and Alexis, there are a few names, and I know I'm going to start calling people out that I recognize from the previous sessions. So if you can unmute and share with us, I can start with Kara, maybe.
Hello, and thank you for calling on me. We are very new to ECM. We actually have yet to actually launch our program, and I really prefer to just be here observing and picking up information right now, but thank you for calling on me.
Thank you, Kara. And it sounds like maybe AIM statement number 2 might align with you guys a little bit better, but maybe we can jump back to that unless you wanted to provide a comment.
Not at this time.
And then let's see, maybe Natalie.
Hi, I don't really have any input on AIM number 1. We're currently contracted for ECM, but we're not providing services yet. So I don't know if I have anything to add either.
Thank you so much, Natalie. Let's see, what about Brianna?
Hi there. I was just going to ask, so are you just asking about which ones make the most sense to us or which ones we would prioritize?
Yeah, we're really trying to determine whether there is an AIM statement that the participants are leaning towards more, or whether which one, if any, align with your organizational priorities or goals in terms of implementing or sustaining ECM and CS services.
Yeah, sure. I'm happy to speak to that. So I'm with Mom's Meals. We're a medically tailored meal provider for community supports. And really what we're focused on, I would say probably is the second one. So improving, care coordination and really just awareness about the program and the knowledge of where to refer. That seems to be where a lot of the gaps are that we find. When I speak to ECM providers and other kind of community partners, they're not sure how to refer to the health plans in their county. And so I would like to build a better network with the other providers so that they're aware of us and what we do differently, so that there are different providers for every service and not everyone fits into each individual kind of square. So there's different things that we all provide and reasons why you may go with one versus the other. And so I think that would be great for people to understand, to try to drive utilization and make sure that people know how to refer and can do so successfully.
Thank you, Brianna. It sounds like there are some elements from AIM 1 that might align with some of what your organizational priorities are, but also it sounds like you are trying to move ECM and CS services forward for other providers or potential providers. Alexis, did you want to pose any other questions?
No, just to thank Brianna for uplifting that, because driving utilization is something that we've heard in this group in past sessions, specifically pertaining to the no wrong door approach to being able to submit a referral. And so I think it's very validating and uplifting of the feedback that we received in prior sessions. And thank you. We really appreciate it. Feel more than free, Brianna, if there's anything else that you would want to uplift about that AIM statement, and also going back to what we're just posing to the group earlier, feel more than free to dive in with just any feedback, because we just want to make sure that these AIM statements are reflective of, you know, how we want to spend this time together. And so, yeah, just very validating to hear that your organization too wants to make sure that utilization is being driven.
Great. Yeah, thank you so much. I think there are there's a lot of potential for this program, and obviously we want to make sure it doesn't go away, right? But if we don't have utilization, that is the negative side there. And so, and also just, we know that there are people in need, and so making sure that everyone is getting equitable access to these services is really important to us. But thank you, really appreciate it.
Great, thanks everyone. Yeah, I'm loving the discussion and dialogue so far. And so you will have time to, again, just provide us additional feedback if there's anything outside of this meeting that may come up for you. Feel free to reach out to us. But I want to go ahead and move us to the polls, just to, again, we're already there, but wanting to gauge a sense of how folks are feeling about these statements. So if we could launch poll number 1, this is to get a sense from you all again, you know, how is this AIM statement number 1 aligning with the goals of your individual team that is participating in this collaborative? So feel free to take a few minutes here to answer the poll, and then we'll close it in about 1 minute. Okay, it looks like we are stagnant at the 9 responses that we have. So we can go ahead and, oh, there's one more. There we go. And let's get ready to close the poll out. Okay. Great. So let's share the results out. So lots of folks are feeling neutral about AIM statement number 1. We've got 3 that are agree with the statement, and then 1 that is strongly agree. So thank you all for responding to poll number 1 about AIM statement number 1. Can we move to poll number 2 as well now and assess folks for the AIM statement number 2? Thank you. Awesome. So I see that the poll has been launched. Again, folks, how is AIM statement number 2 aligning with the goals of your individual team or your participation within this Northeast Collaborative? So we'll spend about a minute or so to get folks' responses in the poll. Okay, it looks like we've got our 10 responses. Why don't we go ahead and close the poll and share the results. So we've got, again, a neutral response. So maybe we're doing a good job at having these great AIM statements. We want to keep both of them. But I want to just probe from the folks who maybe chose neutral as your response. Do you mind sharing what kind of feedback you might have, or thoughts or reactions as you're looking at statement number 2 as well? We have someone who could unmute who had selected neutral for the statement to share.
Hey everyone, Alexis again. Just to double tap on what Mike was uplifting, I think this is incredibly interesting that we're receiving just this feedback that, there's like this neutral reaction to those AIM statements. And so in addition to really wanted to dive a little bit deeper into, why it's landing in a way that's not necessarily I don't know, maybe reflective of what your needs are right now in this moment, would be so helpful for us. And also posing the same question to the individuals that were able to say strongly agree or agree. It would be so great to hear what does work about this AIM statement. And if there's, for those that are neutral, kind of just, toggling on that border, what you feel like might have made these AIM statements something that would push you more like towards that agree. So that way we can just respond, to the need that's in the room right now. And I know like everyone, is at such high capacity right now. So oftentimes we multitask in the background, while attending these sessions. But we just really want to dig in and just dive into specifically what it is that would make this AIM statement, what it reflective of what your needs are. And so, yeah, just really wanting to dive into, that question, why neutral? And then for those that agree or strongly agree, what works and is there anything that can make it even better?
Hi, this is Jenna with Siskiyou County. I just wanted to respond on the neutral. At least from what I feel, a lot of it is just so up in the air right now on what that's going to look like for us. So the ECM. So that's why I answered that way, is just because I really don't know currently what that'll look like. So.
Jenna, that is incredibly helpful. So helpful. And is that something that is just uncertain because you have not launched service delivery yet? Is that fair to say?
Yes, and I know that just from being in other meetings with my director, we're talking about who those ECM providers are going to be. Is that something that we can do within public health? Is it going to be other organizations? So there's still a lot of discussion. So yeah, because like with my program, I work within I work with the incarcerated population. So, I will help them get connected to the Medi-Cal application process while they're still incarcerated. But once they're released, who's going to be that handoff person, or is there going to be someone out there? Is it going to be still a part of our program? So it's still, yeah, like I said, just up in the air. So yeah, I think that's probably the best way to describe it.
Yeah, Jenna, I really mean that. That's so helpful. And I also want to pose that ask to, other members of, or sorry, other participants right now. Is that neutral reaction because you're in a comparable scenario that you don't yet know what service delivery is going to look like? And so you can't necessarily state that your needs align with this. So that question, I'll also add a second part to that. What are the timelines looking like for delivery for a few of our participants today? I know this is very interesting and very good for us to hear. In sessions past, we had a lot of participants and stakeholders that are either implementing and or coordinating with those implementers, or entities that were uncontracted seeking a pathway. But this is new for us. There's this middle group right now that is, waiting. There's this waiting period. So you're trying to figure out what that looks like. And I also wonder if there's some pre-implementation support that could be useful or beneficial to those groups that are in that neutral positioning as well. So yeah, just throwing that out for processing to see if anyone has feedback on, if that lands with them as well. Michael, and if there's no feedback right now at the moment, it would be completely fine to move forward with some chartering if you want to move into that.
Yeah, sure thing. And feel free to continue thinking through what Alexis had just mentioned. But yeah, I'm going to keep us moving along so that we can get to our larger discussions around the driver diagrams and the measurement strategies. So what you're seeing right now is the draft project charter for the Northeast Collaborative. And so this really is meant to capture our work together over the next several months. And so I won't go into detail, but you do have these slides as well that you can refer back to. I just wanted to share with you all the various components of the project charter that we are developing for the Northeast Collaborative around goals. What is the expected impact? Who are the key stakeholders, which include all of you who are on this call, some of the milestones that we have as well, with just some estimated frames of our goals and what we hope to achieve through the collaborative. If we go to the next slide, the next slide is then diving a little bit more into what some of the deliverables are and the objectives of this Northeast Collaborative, utilizing SMART objectives. And so we have identified 3 goals, and under each of the goals, we have some objectives that we hope to achieve through this work together. And then if we go to the last slide, this slide of the project charter includes the continued deliverables and objectives, as well as the constraints and the assumptions, dependencies, and risks that have come up in our previous sessions from participants and providers. And then today, really wanting to discuss, what does success look like at the end of the day? Once we hit December 31st of this year, how will we know that we've been successful in achieving the improvements to all of the challenges and barriers that have been identified previously? And so wanted to just give folks that context of what the project charter includes. I want to move us to a poll as well, but I'm also just thinking, if this is folks seeing it for the first time, maybe we can skip the poll and you can let us know just how this is landing for you all. Maybe we can get a sense from folks, does this align with where we are moving towards with this collaborative? So I'll just pause there and see if anybody would like to chime in.
Maiku, I am going to process this with the group right now because I want us to be flexible and meet the need of the moment based on what the participants are sharing and uplifting with us. And I think that we're recognizing and calling out that the needs of this group are very, very different from the feedback and content the feedback that we've received over the past couple of months. And so I think that it might be helpful, considering that we had a number of participants that were neutral. I'd like to just test the waters and see something. For the project charter, for those individuals that stated that the AIM statements were reflective of your needs, I am wondering here if it might be a good decision or a good option for us to maybe rethink how we were going to approach those breakout sessions. Perhaps we would be able to move forward in the breakout sessions in lieu of doing those contracted providers and entities that coordinate with those providers and the uncontracted providers that are trying to move forward in this process. I'm wondering if it might be supportive of those that are neutral, since there were so many, for them to have a unique conversation separate from the project charter, because there might be some pre-implementation support that those entities might be seeking out in this space. And I'd really like to figure that out, exactly how we can make sure that this space is being utilized to your needs. And I know that this is an unexpected shift in facilitation. So I am not married to the approach, but I do want to make sure that this is a space of value, for all of our stakeholders, and that we are responding to, what you are in this space for. So for those that are neutral, would it be helpful for us to have a unique conversation, just trying to, place a name to what pre-implementation support you need? And for those that are in alignment with the AIM statements, would it be supportive to be able to break off into that breakout room to review the project charter? So I'll let the group decide, but I at least wanted to give us the option.
Yeah, thanks for bringing that up, Alexis. I think that makes a lot of sense. I'm looking at Vince as well as our co-facilitator. So, if we were just to recap, right, if we were to move on to our next one, we wanted to do 2 breakout rooms, one that would focus on those who were neutral and discussing anything around pre-implementation needs. And then the other group would be on focusing on additional feedback to the AIM statements and the drivers. So Vince, wanted to get your thoughts also on moving forward.
And definitely welcoming, participant feedback as well.
I was
I
gonna
just want to,
say,
yeah, definitely re-uplifting that we want to use this space how you need this space utilized. That's so important to us.
maybe we can just get a show of hands. If we were to break out 2 groups, which one of you would be interested to discuss some of the pre-implementation needs that correspond to AIM statement number 2 or 1, right? Who would like to just have that discussion? Maybe we can just have a show of hands. And then the second breakout room would be discussing more in detail some of the project charter, and maybe have an additional conversation about the driver diagram that we can show you for that breakout session, right? So some of you are attending this for the first time, and some of you have been in at least 2, or this would be your second one. So you have an option of which one you'd like to participate in either breakout session, either a show of hands, or you can also use the chat function here where you can have a vote. So let's say breakout session number 1 is to have a feedback session conversation with you all about the AIM statements that have been shown to you, AIM statement number 1 and number 2. And the second breakout would be talking about the project charter and driver diagram. So 1 or 2, which one would you like to have participation in? So Brianna is number 2. Number 2, project charter. Yeah, number 2 is project charter. So it looks Brianna, Toby, Jorge is on breakout 2. Natalie's breakout 2. Kara's number 2. Okay, so more than half of you so far. 6, 7. Donald is number 2. So that's okay. That's pretty close to majority. Who has not voted? I just want to make sure that we're capturing everyone. Norma, do you have a preference?
Today's my first meeting. I don't.
Okay. All right. So, okay. And who else has not? Donald, you have voted. James. So I'm just gonna recommend then that we have one big conversation about number 2, about the project charter.
I
Yeah?
agree, Vince. And I also want to propose as well. I know we've been having a lot of one-on-one conversations offline. So in addition to being able to move forward with that project charter conversation, we will definitely touch point offline with those individuals that are new to the collaborative, just to make sure that your needs are being met and that we can uplift if there are some pre-implementation issues or gaps that you would like to address before you reach that milestone. And thank you so much for uplifting that as well. And Brianna, yeah, thanks so much. Jenna, thanks so much for just letting us know where you all are at in this process and for uplifting something that's new for us to hear in this space today. Yeah, so sorry, Mike and Vince, I will step back.
No worries. That's really good process. And now that we've heard back from majority of you, most of you, I think what we'll do is keep you in one big group to talk about the project charter, right? So we'll continue. Maiku, do you want to continue with the discussion around the project charter?
Yeah, so let me see here. We do have the project charters again for folks, and maybe we can go to those slides at the beginning again. Even if we're going to be diving into that discussion, let's actually walk through it together before we discuss. And so yeah, starting us back at the top here. So goals, right, that we have identified for the Northeast Collaborative. We want to define problem areas. So that means identifying the strategies and tactics needed to collectively tackle the core problem areas and barriers identified by participants. And goal number 2 is around accelerating implementation. So strengthening the existing relationships between stakeholders to streamline and accelerate implementation, and then sustainably increase capacity by working with stakeholders to implement CalAIM initiatives as fast as possible and reach as many people as possible in a way that is sustainable. So let me just pause there and get a sense from folks. Do those sound like some goals that resonate with the charge of this group, or the, you know, bringing together this collaborative? Is that something that captures for folks? Maybe we could also use the thumbs up if it does, or use the chat. How are folks feeling about the 3 goals listed here? Got a thumbs up from Jorge, Brianna, thank you. Okay. Just check the chat. Okay. These look good. Thank you, Natalie. Thank you, Jenna. I see the thumbs up. Okay, so I think we're good on the goals there. So now what is the expected impact that we want to have, right, as this collaborative continues to meet? So you know, one, that the managed care plans or partnership health plan for the Northeast counties will have stronger relationships with ECM and CS providers in order to streamline the process for feedback around implementation and resolutions and create transparent consistency across. The second impact that we want to have is for our ECM and CS providers to have the implementation tools and capacity building that they need in order to execute these programs efficiently and successfully reach as many eligible clients and community members as possible with the available funding. So I'm going to pause there again and see how does this sound in terms of the expected impact for this project charter? Feel free to use the thumbs up or the chat again, or mute or unmute. Toby, thank you. Looks good. Appreciate that feedback. How about others? Great. Okay. Got some thumbs up as well. So appreciate you all. And then really the next piece is just describing the key stakeholders who are a part of this collaborative. So this includes our managed care plan, a partnership health plan. I actually don't see Danielle here today. I don't think she's able to make it, but Danielle is with partnership health plan, and they do engage in this collaborative as well. I'm not seeing Danielle, so maybe she might pop in later, but typically they join us for these sessions. Wanted to also share the other folks. So of course, our ECM and CS providers are in this space, any intermediaries, data and information hubs, as well as TA providers. So those are our key stakeholders that we are engaging within this collaborative. And so I'm going to move us to the milestones then. And thank you for the questions, Natalie. I see about, yes, whether the MCPs are in this group. So a couple of milestones with estimated timeframes here. So by March 2023, which is this month, and we want to finalize all of these content documents and materials, including the AIM statement, project charter, objectives and measurements, which is a part of today's discussion. By April, we want to begin implementation in support of the Northeast work plan and co-creating that work plan together with you all, right? What are those specific needs, challenges, and how do we get to the action and solutions there? In April as well, we want to launch progress reporting and ensure that we have quality improvement strategies to monitor and improve progress toward the objectives we've listed. By June of this year, we want to conduct the first round of an evaluation just to check our progress on the Northeast work plan. And then by the end of December 2023, conducting a final round of evaluation on the Northeast work plan. So those are just some key milestones that we want to keep in place as we move together in this collaborative process. But how are those milestones landing with folks as well? And I also wanted to definitely open it up for any questions if folks are, if any questions are coming up for you as well, that we can help to answer. Okay, we'll come back to this. Maybe we'll keep us moving along in the project charter. And so can we move to the next slide, Eva? Okay, so now we're going to talk about the deliverables and objectives. And so as I mentioned earlier, we have 3 goals. And so under goal number 1 of defining the problem areas, we've developed these 3 objectives. So under objective 1, by April 30th, we want to surface the problem areas and barriers identified by MCP, ECM, and CS providers across the 5 Northeast counties with CalAIM implementation in the following areas. So that includes capacity development, improved care coordination, data sharing and workflow systems, and sustainability. So we're seeing those themes come up across what Vince had presented earlier, right? So those would be really the following areas that we would be focused on. Objective number 2, by May 30th, we hope to develop a Northeast work plan that addresses and outlines 2 to 3 strategies and tactics to implement solutions in the problem areas and barriers that, again, were lifted up. And objective 3 is to, by December 31st, work with partners to identify needs around capacity building, any toolkits, and any support, right, to help prepare both ECM and CS providers in their program implementation. So I'll pause there before moving on to the other goals. This is really getting more so towards tactics and strategies under each bucket. So how are the objectives landing for folks under goal number 1? And feel free to use the chat again or thumbs up. Thank you, Brianna. I see a thumbs up. Okay. All right, I'm going to keep us moving along here as well. Thank you, Toby. Says it looks good. So let's move to goal number 2. Goal number 2 of this collaborative is to accelerate implementation. So under that, we have 1 objective, which is by December 31st, 2023, conduct monthly CPI sessions, which you all are participating in right now, to convene CPI stakeholders, to engage in open dialogue and discussions, peer-to-peer learning, to share best practices, approaches, as well as troubleshooting on the ground CalAIM implementation issues collectively and in real time. So by the end of this year, we will have held 12 sessions. 12 monthly sessions, and this is our monthly session number 3. So we are already a part of this objective and achieving that. And then also by the end of this year, by December 31st, we will have conducted one-on-one interviews with at least 30 partners and providers and outreach to deepen relationships between collaborative stakeholders. So as Vince mentioned, in between our sessions, we've been holding one-on-one sessions. And if you all have any referrals for who we should be connecting with outside of this space, those are the partners that we want to make sure we have conversations with as well to help deepen relationships. So I would love to just pause here and see how that is landing also for goal number 2. All righty, thank you. And in the chat here, looks good. Brianna, those are great goals and will help drive utilization and access for members. Got awesome from Toby, thank you. And then Alexis, good to hear and happy to be part of the interviews. Thank you, Brianna. We can certainly add you to our list of follow-ups as well for a conversation. So let's go ahead and do that. Okay, thank you all. Let's move us to the next slide. Okay, so this is the last slide on our project charters. And so under goal number 3, which again is to sustainably increase capacity. So how will we do that? Objective 1, by December 31st, 2023, want to partner with Partnership Health Plan to provide the necessary technical support to help at least 20 small providers to be ready to implement their CalAIM initiatives within their county or counties, if you cover multiple counties. Objective number, the second bullet, by December 31st, 2023, we also hope to facilitate connections between 20 stakeholders to enable discussion and implementation on capacity building. So again, just building off of those one-on-one conversations, making sure that we are connecting with each other in this collaborative. So how are the objectives under goal 3 sounding for folks also? Great, thank you, Jorge. I see a thumbs up. All right, I'm going to move us to the next piece here around constraints, assumptions, dependencies, and risks. So again, this is what we have heard and what we've learned from you all over the last couple of months together. The points below have captured the constraints, assumptions, dependencies, and risks that have surfaced from the CPI collaborative sessions held thus far. And so at the top, workforce capacity and skills to implement programs, that there's no clear pathways for smaller providers to participate in HIE or health information exchanges. Partners have identified resource sharing and collaboration across counties that we've heard in this collaborative, that there's low capacity in participating in collaboratives. And lastly, there's also been confusion surrounding the implementation of PATH programs. So just wanted to lift up that, those are some constraints and assumptions, dependencies, and risks that have surfaced as a part of our conversations. And then lastly, I'll just move us through is measures of success. So this is still to be developed and also a part of what we really want to get a sense of from folks today about just, how do we measure the success, right? Based on the 3 goals that we've just outlined and walked through together. So I will pause there and see if folks had any questions, thoughts. Maybe we can even go to the poll question now for the project charter and actually ask folks how this is landing for you all. We'll do another 30 seconds, so a couple more responses, I think, and then we'll close it out. Okay, we'll give it another 5 seconds and then we'll close the poll out. Okay. Great. All right, so just looking at our poll here, thank you all. So we've got 2 for strongly agree, 1 with agree, and then neutral. So it is, again, a good balance there. I want to just go ahead and see if folks wanted to share any thoughts or reflections or reactions to the project charter, but thank you all for participating in that poll, and just wanted to, again, open it up for any reactions, thoughts, or comments. Okay, I'm not seeing any, so I'm going to go ahead and Vince or Alexis, do we want to move us to the driver diagrams perhaps and start to at least introduce those concepts? I just wanted to do some check-ins here.
So I just want to maybe what we can do, because we have about 20 minutes and our plan was to have a breakout session and have the group here divided into 2 groups to look at the driver diagram for each of the AIM statements that we have drafted. So I'm thinking, because we're pressed for time, that perhaps what we can do is have a collective conversation about the driver diagram, looking at, the AIM statement, maybe spending maybe 10 minutes for each of the AIM statements with the entire group, talking about the first AIM statement and the diagram, the driver diagram, and then after 10 minutes, moving into the second AIM statement and looking at the driver diagram for that one. And at each opportunity, we would love to hear from you in that conversation. It looks like folks are in agreement, yeah? So, Michael, I'll turn it over to you.
Great, thank you. I was finding my unmute button. All right, sounds good. So just to keep us moving along here. Again, with the breakout rooms discussions, we want to cover, sorry, we're going to do a large group here. We will cover the driver diagrams, as Vince mentioned, based on each AIM statement. So what we want you to think through with you all is what are some of those primary drivers which we'll need to work on in order to achieve our aim. A secondary driver is what we need to put in place to positively influence our primary drivers. And then also identifying any change ideas that are expected to help achieve the aim. And so wanting to just focus on those elements of a driver diagram. And so we do have one example. If we go to the next slide, Eva, wanted to just show folks just something that our team had helped to draft up. This is all just some initial language based on what we've heard from you all, and we really developed this for AIM statement number 1. So what you're looking at is a driver diagram. You see for the primary drivers. We've included the 4 areas that we've heard, but again, want to open up that conversation. All of this is draft, and so really want to get your feedback on whether this aligns and makes sense, right, as a primary driver. And then secondary drivers are building upon those primary drivers, right? And so again, this is all draft language that we want to discuss with all of you. Alexis, I also saw that you unmuted as well. Wasn't sure if you wanted to add anything else.
Yep, quick eyes, Maiku, quick eyes. I did want to just add one quick comment, just reflective of what Brianna was uplifting earlier about wanting to drive increased utilization of ECM and CS services and benefits. When we are thinking about these AIM statements, because I know for some primary drivers, secondary drivers, change ideas, it might sound, Martian. So when we're thinking about, increased utilization of those services, what's going to make that happen? That's literally all this conversation is about is, at the bare minimum, what do you need in order for us to reach these goals? And so, EIC spent some time working on some drivers based on the feedback that we had received from prior conversations. And for example, in order to be able to improve care coordination, referrals, workforce development, so on and so forth, some organizations need increased capacity. That's, one of the main issues that some, providers called out. And what does that mean so far as that capacity building? What specific types of capacities? For some, it was quite literally additional staff. For some, it was better infrastructure with IT systems. So when we're just thinking about how we're going to realize, the goals that we have together, what do you need and what ideas do you have? We quite literally want to chronicle your ideas so that way we can put a work plan in place to start to act upon those change ideas. And so I just wanted to add a little bit of context to how we're trying to collect this information. And so just feel more than free to just throw out any type of ideas that you have for what you need to make this a reality.
Great, thank you, Alexis. And then if we could just switch, I think, Eva, are you screen sharing right now? So if you can actually pull up a side-by-side as we discussed, and that way, as folks are thinking through what are some of those, again, primary drivers, secondary drivers, we can actually fill it out together in real time based on what and how folks are feeling about AIM statement number 1. So we'll give Eva just a moment there and give you all a few seconds or so to think about a response or a question that you might have coming up for you. All right, thank you for pulling that up together. Great, just wanting to lift up Brianna's question. What would help us understanding what each provider can offer the members, which providers are contracted in each county, and then referral process and workflow expectations?
That is great, Brianna, thank you so much. And so I'd like to, Michael, if it's okay with you, to just take that line by line and just break that down really fast. So understanding what each provider can offer to the members. So Brianna, when we hear that, I want to process that as, is there a need for provider networks? Is there a need to understand like where the referral network is and what services, ECM and CS services are available within a specific region? Is that what we're discussing there?
Yes and no. I think it's also like what we do differently, right? So like as a meal provider, we provide refrigerated meals, and then we have certain like chronic conditions that we can meet, like renal and Puree. Other providers may provide hot meals or frozen meals. So I think in order to tailor it for your member, it's great to know what the differences are between them. And that may be like way further down the line of priorities, of course, like referral process is probably first. So maybe I'm out of order here in my thinking, but more so in order to put a member with the right services, you'd need to know what each provider is actually providing for that service, if that makes sense.
No, thank you so much. And we're quite literally documenting this on the back end. And that is just quite literally just an amazing example. And just to go back to what you were saying, like this, it's understanding what each provider offers. And then to take that just the first, another step deeper, what does that change look like? I mean, and this does not have to be something well refined or perfect. It's throwing spaghetti at the wall and like seeing what sticks. Is this a provider directory? What is the idea that could come forth for being able to actually like allow you to know, like in your, if we were shooting for the moon right now, what would that look like?
It could be like I don't know, it could be like an in-service. I mean, that's typically what we provide to ECM providers and others to let them know about what we do. Like, and that could be even shorter, or it could be a couple of slides. It could be a one-page document, like whatever. I guess it depends on how we're organizing that information, but a directory I think would be great. Like, here's the contracted providers, and I know it does change quite a bit. So that's the other thing, is that it would need to be updated quite frequently, because plans are kind of contracting with new CS and ECM providers on a regular basis. But like here's the contracted providers for each service. Here, or actually even going back further than that, here's each health plan in the county. Here are the services that they are contracted for. Here are the providers that they are contracted for each service. And then, here's the contact information for those individuals, or, I mean, definitely that, or here's the referral process. So kind of like a, I don't know, decision tree, or like a, from after each question, you'd get like another box or something if you were like filling out a survey or something like that. Not survey is not the right word, but
no, we totally process the feedback that you provide, and it's something that's living, and it's something that is updated regularly, and it's something that publishes all of this information to provide the stakeholders with easier access. And so this is phenomenal. And so thank you, Brianna, so much for that. And I know, Vince, as you flagged earlier, that we were getting short on time, but I want to propose to the group, considering that I know this was sent out a few days ago to all of the registrants, but just to allow everyone a little bit more time to sit with this. I know that we just received those amazing examples from Brianna. We'll definitely go ahead and tie those back into the driver diagram. But just posing the question, if there's anything else that anyone else can think of that would make this a reality for them. And if not, we can definitely follow up in those one-on-ones, and Vince, we could feel more than free to head into the next driver before closeout. But yeah, just taking a pause really fast before doing that to see if there's anything else that anything else that anyone else would like to uplift.
So maybe at this point we can move to the second driver diagram, which is corresponding to AIM statement number 2. And for those of you who are uncontracted, this might have more resonance for you, but let me read for you again. AIM statement number 2 is to build the capacity of Northeast stakeholders in the early phases of CalAIM implementation. By December 31, the collaborative will increase the number of eligible or uncontracted ECM and CS providers that have secured CalAIM contracts by 25%, and support at least 50% of remaining eligible, uncontracted, in parentheses, providers to move to the negotiation stage in the contracting process. So for this particular AIM statement, basically posing the same questions to you. What support do you need to make this a reality? I know that some of you are new to the space. For those of you who attended last session, maybe you have more feedback on this. I don't know if you have any additional thoughts. So the question again is, what support do you need to make this a reality? And some of it, Brianna may have covered in discussing AIM, the driver diagram for AIM statement number 2 or number 1 rather. But for this one, some could overlap, but if you have any additional new thoughts, feel free to chime in. Would you have any thoughts? I know that last meeting, we have a couple members here who were there for last time. Any thoughts from you? I think Natalie was there. Kara, I know you're still in the early stages, right? Do you have any additional input?
So it sounds like AIM statement number 2 is about getting more people contracted in order to provide ECM and CS. Is that right?
Yes, correct. Absolutely.
We're contracted. We've been contracted for a while. And I'm always willing to help people or share our process for contracting. That's totally fine if people are struggling with that process. But it's not aligned with our needs at this time because we're already contracted.
I appreciate that, Natalie. So perhaps one of the things that can be helpful is really that peer-to-peer conversation, right? Between someone like Natalie and another person here in this space who may be thinking about how to join the collab or the network of providers, right? Thank you, Natalie. So we could probably lift that up as an example, right? What do you need? Peer-to-peer support, right? And we have someone here is potentially willing to be part of the conversation around that. Anything else that you'd like to add?
I think, yeah, peer-to-peer, I think that's probably what I can get the most out of from this type of group is that peer-to-peer collaboration. I appreciate that you guys are trying to form a structure. It's just the language you guys are using is very different from what service providers generally use. And I think that's creating a barrier and figuring out how it aligns with goals. It took me a while to figure out what did you guys mean by charter, what do you mean by AIM statement, and to figure out what that AIM statements actually meant. So for me, that collaboration and that one-on-one being able to have those discussions in the breakout rooms in smaller groups are super valuable and have led to the most change and help in the way that we do things. So yeah, that's my input.
Yeah, thank you so much. That's really good feedback, Natalie. Sometimes sometimes some of the language used is, it needs to be broken down a little bit more, right? So after that's broken down, then we can have a conversation about, what it really means, right? So appreciate that. And also lifting up again, how creating a space that has peer-to-peer conversations is really helpful. May I call on, let me see, on my screen, Jorge? Jorge, how does this land with you?
So we're already contracted, but I do agree with with all of it. I think it's important to definitely grow, especially in that region, the ECM side of it. We do have some direct referrals that might have some ECM provider that's not as easily contacted. So collaboration is always going to be key. And, I think as we grow and get more contracted providers, that also helps just the region in general. And then I think that someone had mentioned collaboration between some of these other services is definitely going to be helpful. Partnership specific is really great about sharing their partners, which is great, no pun intended. And I think, again, this is my first time joining. I think as we dive into these statements and start identifying some of the problem areas or barriers that we're facing, we could kind of see a lot of what I think you guys envision and what support we all might need as providers or upcoming providers. The collaboration is always going to be key. Some of us might, like Mom's Meals, work in certain realms where maybe on our side we're not as strong. So I think collaborating and intermingling in these meetings is going to be really supportive, at least to us on the Serene side. So just kind of my feedback being my first meeting here. And I look forward to some of these individual breakouts as well. And as we get into specifics on some of the, like I said, barriers down the road here that we face.
All right, thank you, Jorge. And just for additional information, in the one-on-one conversations that we've had, and hopefully we can have these one-on-one engagements with you too. We've spoken to T. Abraham, who's part of a hospital association. We've spoken to Roger Page, who's part of Dignity, John Helvey with Health Information Exchange, Caleb Ott with Shasta. So just to give you a flavor of who we've been having conversations outside of this, right? So those are potentially resources also that we can invite to the group and you to reach out to. So thank you, Jorge. We have a couple more minutes left, and I'd like to, we haven't heard yet, James. James, can you talk a little bit about what you do and if this resonates for you in terms of what might we include in the driver diagram for AIM statement number 2?
Hi, everyone. Yeah, I'm with MedZed, which is an ECM provider. So we're contracted with, a couple counties. But I'm not too sure yet. This is my first meeting. So all the information has been pretty valuable for me. So just looking to learn with the group and, to continue participating in the next session.
Thank you, James. Really appreciate that. And knowing that many of you are still on the same boat with having this meeting being your first one. So with that, we'll wrap up the conversation with our draft driver for AIM statement number 2, and I'll turn it over to Maiku.
Thanks, everyone. Really appreciate you all just being so open. I know this can be a lot of information, but the fact that we are all working on this together, I want us to just keep that spirit of collaboration and that, we really are here. Our hearts are in the right places of wanting to do good with the programs and to serve our community members and get them the access they need to these programs. So really appreciate everyone today and just what you all have given us feedback on. And so I'm actually going to pass it to Melissa to go ahead and close us out. And Eva, if we could bring up the slides again, just to go through the next steps and what we'll anticipate for the upcoming session as well.
Yeah, thank you so much, Maiku. And Eva, if we can just share slide 31. So I know we are 1 minute from ending this session, so I'm just going to touch on this really quickly. Please look out for an email from us for any additional items, but for next month's session, we'll focus on initiating the implementation of our collaborative work plan. On the back end, we'll send out some one-on-ones so we can really refine these AIM statements, project charters, and driver diagrams that will inform how we decide to implement some of that work for our collaborative work plan. Again, we do have a couple of post-event action items. So as a participant within this group, we are asking that you guys complete some of the assessments that we send out. That includes any surveys or post-event emails that require you to review any agendas or any of the materials that we're going to cover for the upcoming sessions. And then we can also, discuss those during one-on-ones. For registration, please use the link in our follow-up email to register for the April session. We are also sending out calendar invites, so please check your spam, see if they went in there. And if you want to attend the upcoming sessions, Eva, our project coordinator, will be sending those invites out. As I mentioned at the beginning of the session, we were recording this, and so the slides and supplemental materials will be provided via email. And then finally, if you have questions, again, you can contact Eva at healthbegins.org, who's our project coordinator with Health Begins. And finally, please support recruitment, spread the word with other potential CalAIM stakeholders. This is your space, and we are really trying to ensure that we are providing you with the peer-to-peer support. I'm not going to go through the rest of the slides because I know that we are at time, but if you do have an opportunity, there are some PATH funding TA services that are coming up through DHCS that we encourage you to take a look at. But yeah, thank you all so much for joining. I hope you have a great rest of your day, and we will see you next month.
Thanks, everyone.